Welcome to my presentation on seizure disorders. Seizures are defined as episodes of abnormal motor, sensory, autonomic, or psychic activity that results from a sudden excessive discharge from neurons in the brain. These abnormal, recurring, and uncontrolled electrical discharges result in seizures. Epilepsy is defined as at least 2 unprovoked seizures occurring more than 24 hours apart, whereas status epilepticus is defined as a series of generalized seizures that occur without full recovery of consciousness between attacks. This would be considered a medical emergency. There are 3 main types of seizures: focal, which originate within one hemisphere of the brain; generalized, which occur in bilaterally distributed networks; and unknown seizures. Characteristics or signs of a seizure include a loss of consciousness, excess movement or loss of movement, and also disturbances of behavior, mood, sensation, and perception. Seizures can range from a generalized absence seizure to prolonged convulsive movements with a loss of consciousness. Some evidence suggests that susceptibility to some types of epilepsy may be inherited, but the cause of seizures in many people is mostly unknown. Epilepsy can follow birth trauma, head injuries, some infectious diseases, toxicity, circulatory problems, fever, metabolic and nutritional disorders, or drug or alcohol intoxication or withdrawal. It is also associated with brain tumors, abscesses, and congenital malformations. Head injury is one of the main causes of epilepsy and is largely preventable. Status epilepticus may be caused by interruption of anticonvulsant medication, fever, concurrent infection, or other illnesses. Diagnosis of a seizure disorder would include an extensive patient history, an MRI, and also an EEG. A potential complication of seizure disorders would be injury during a seizure. In addition, respiratory arrest at the height of some seizures can produce venous congestion and hypoxia of the brain, which can result in fatal brain damage. Medical management of seizure disorders varies from patient to patient, since some patients with epilepsy have the disease due to brain damage, and others have it resulting from altered brain chemistry, and others from altered brain anatomy. Surgical options could be indicated for a patient whose epilepsy results from tumors, abscesses, cysts, or vascular anomalies of the brain. In these cases, removal of the area that's generating the seizures could be a long-term solution for improved control and improvement. For the patient with focal seizures, a vagal nerve stimulator may be implanted under the clavicle, where it would connect with the vagus nerve and deliver electrical signals to the brain to control seizure activity. For the patient with refractory seizure activity, the responsive neurostimulation system is a surgical option. It is an implanted device in the brain that works by sending electrical stimulation to interrupt brainwave activity before a seizure can occur. For the patient with status epilepticus, the goal of treatment would be to stop the seizures as quickly as possible. So an airway would be established, and if the patient is unconscious and unresponsive, an endotracheal tube could be inserted. IV diazepam, lorazepam, or fosphenytoin would be given slowly in an attempt to halt the seizures. The goal of pharmacological management for seizure disorders is to control, but not necessarily cure, the seizures. Treatment usually starts with one single medication, and the dosage is increased depending on the occurrence of side effects and effectiveness of the medication. Some side effects from anticonvulsant medications could be allergic reactions, which usually present as a skin rash for anticonvulsant medications. And it is also important to note that seizure medications would be taken throughout the patient's life. Also, a side effect of long-term use of phenytoin would be gingival hyperplasia. And during the use of phenytoin, the phenytoin levels in the blood would be monitored. So prevention of seizure disorders or the worsening of seizure disorders would include medication adherence if the patient is on anticonvulsant medications, and also prevention of head injuries. So these are two important aspects of preventing seizure disorders or the worsening of seizure disorders. Nursing care during a seizure includes providing patient safety. That's the main concern. The patient should be laying on their side and should be on the floor if possible, or if not, they should be on the bed with the bed in its lowest position, and also pillows should be removed and the side rails should be raised. The patient's head should also be protected with a pad, but not necessarily a pillow. Constrictive clothing should be loosened, eyeglasses removed, oxygen and suctioning equipment should be readily available. Patient privacy should also be provided, and the nurse should also note the time that the seizure began. After the seizure, the nurse should ensure the patient remains on one side and continues to have a patent airway. The nurse should reorient the patient and continue to provide a safe environment for both patient and nurse. One priority nursing diagnosis related to seizure activity would be risk for injury related to seizure activity, because injury during a seizure is a potential complication of this disease. Nursing interventions would be to prevent injury, to control the seizures. Another goal would be achievement of satisfactory psychosocial adjustment, acquisition of knowledge and understanding about the condition that the patient has, and absence of any complications. The patient and family education would be also very important in the nursing care of a patient with a seizure disorder. Thank you.